When it comes to the heart, we know things that exercise, diet, weight can make a huge difference. But did you know that sleep also has an impact on your heart? The American Heart Association recently added sleep duration to its Healthy Heart Checklist. So here to tell us more about what that means is Dr. Eric Hemminger, a cardiologist with Denver Heart. So to start, doctor, what's the connection between sleeping and your heart?
Well, your heart works really hard. It beats 100,000 times a day, and it needs its rest just like the rest of you. Your heart really, it needs that time to restore and repair. You build up kind of cellular damage throughout the day, oxidative stress on your heart, and you need that time to recover. A normal adult, needs 7 to 9 hours of sleep, and most Americans aren't getting that.
Yeah, I'm definitely one of the ones that does not get enough sleep. Tell us too, sleep is now part of life's essential 8. That's the American Heart Association's checklist. What are some of the other factors in the essential 8?
Well, so the essential 8 is really just kind of taking the high yield things and focusing on those, the things where people can really make a big impact in their health. So it's four health behaviors. Sleep being one of them, physical activity, avoiding smoking, and also eating right are the other ones. And then four other health factors that were kind of the traditional risk factors for heart disease. So keeping your blood pressure, blood sugar, your weight, and your cholesterol under control. Those are the 8 really high impact things that have a measure on your cardiovascular health.
Absolutely important to think about. What are some of the warning signs that you may not have a healthy heart and need to see a cardiologist?
Well, it relates as far as relating to sleep. If patients that are tired a lot during the day, have daytime sleepiness, or feel fatigued all the time, is a red flag. Especially if you have high blood pressure that your regular primary doctor is having trouble getting under control. We call resistant hypertension. That's a red flag that you may have an underlying sleep disorder. If your sleep partner says that you snore at night or you don't breathe well at night, those are also red flags that you might have the double whammy of not just poor sleep, but sleep apnea, where you actually stop breathing at night as well, which puts a lot of strain on the heart, increases your risk for not only high blood pressure, but increased risk of heart attack and strokes, and even heart failure or sudden death. So it's important, if you have those symptoms, to talk to your doctor about it.
Great. And, is there anything else you want our viewers to know about heart health, or any suggestions of getting things checked, or anything else they need to know?
Yeah, just focusing on those 4 factors I mentioned, to keeping blood pressure under control, cholesterol, if you have diabetes, making sure your blood pressure is under control, and, your weight. Those are the real core things for cardiovascular health. And then one thing is, we talk about sleep hygiene, which is kind of like, good advice, just like brushing your teeth is good hygiene, going to bed at a proper time at night, keeping your devices out of the room, setting up an environment for success so you have a nice restorative, a restful sleep instead of a stress response, which is what happens when you don't breathe well at night and you're not getting that good quality sleep. Absolutely.
And that kind of brings me to another question. What about napping? Does that help? Is that good, bad?
Certainly, napping is good. There's some data that people that sleep more than 9 hours a day may be at some increased risk for cardiovascular disease, but there's probably nothing wrong with a cat nap during the day.
Absolutely. Well, thank you so much, doctor, for taking the time to talk to us. Important stuff. We appreciate it.
Thank you.
Of course. And we'll put a link up to the American Heart Association's Healthy Heart Checklist at cbscolorado.com.